Have you ever wondered what types of maternal and child nursing questions will appear on your nursing board exam? What if I told you that 10 questions we're about to review might be exactly what you'll see on the 2025 PNLE? If you want to boost your confidence and be fully prepared for these critical exam topics, this video is for you. So, grab your pen and paper. We're about to dive into the most important maternal and child nursing concepts you need to master before test day. Hello, Philippines, and hello, world. Welcome to NurseBrain, and I'm Neil Brian Galvez. And today, we're focusing on crucial area of your nursing education, maternal and child nursing, or MCN. In this lesson, or should I say examination, I'll be giving you 10 high-yield questions that test your knowledge of maternal and child nursing concepts. But I won't just be asking questions. I'll be guiding you through the rationale behind each answer, helping you understand not just what the correct answer is, but why it's correct. Pay close attention to the strategies and techniques I use to approach each question. These critical thinking skills will help you tackle similar questions on your actual board exam. So, grab your pen and paper because you'll want to take notes as we go through these challenging but essential concepts. Here's how this will work. I'll present 10 board exam type of questions. For each question, I'll read both the question and the answer choices. You'll have 5 seconds to select your answer before I reveal the correct response along with a detailed explanation. Choose the letter of the correct answer for each question. Good luck, nurses. Board exam type of question number 1. A client asked the nurse what a third-degree laceration is. She was informed that she had one. The nurse explains that this is, nurses, I want you to pause for a while, pause this video and listen to me. This is a type of question that is asking you for more of like a definition of terms. It's very simple. What is a third degree laceration? That's the question. All right, let me read to you the choices. A, that extended their anal sphincter. B, through the skin and into the muscles. C, that involves anterior rectal wall. Or D, that extends through the perineal muscles. Your 5 seconds starts now. Time is up, you guys. The correct answer is letter A, that extended their anal sphincter. A third-degree laceration involves all the tissues included in a second-degree laceration, plus the external sphincter of the rectum. Option B, C, and D describes aspects of second-degree lacerations, not third-degree. Understanding the degrees of perineal laceration is crucial for proper postpartum assessment and care. I hope you got that one right. Let's proceed to board exam type of question number 2. Bettina, a 30 weeks AOG, was discharged with a diagnosis of placenta previa. The nurse knows that the client understands her care at home when she says, nurses, this is like a type of question that is asking you for what will be the positive feedback from the patient where you just gave her the health teachings. And in this situation, it's about placenta previa. A positive feedback from your patient that will tell you that your health teaching was able to come across successfully. That is the question. Let me read to you the choices. Is it A, I'm happy to know that we can have sex occasionally when I have no bleeding? Is that right? B, I'm afraid I might have an operation when my due comes. C, I will have to remain in bed until my due date comes. Or D, I may go back to work since I stay only at the office. Your 5 seconds starts now. Time is up, you guys. The correct answer is letter C. I will have to remain in bed until my due date comes. Here's why. Placenta previa means the placenta is the presenting part. In the first and second trimesters, spotting may occur. By the third trimester, bleeding or typical sudden, profuse, and painless. Bed rest is essential to prevent bleeding episodes. Sexual activity, option A, is contraindicated as it could trigger bleeding. while cesarean delivery, option B, is likely. This doesn't indicate understanding of home care. Returning to work, option D, is inappropriate due to the risk of sudden hemorrhage. Question number 3. The uterus has already risen out of the pelvis and is experiencing farther into the abdominal area at about the... Now this question is really asking you about how many weeks of pregnancy do you think this patient have if the uterus has already risen out of the pelvis and is experiencing farther into the abdomen. So based from your knowledge of MCN, and when we discussing about pregnancy, based from this manifestations from your patient, how many weeks of pregnancy do you think this patient is or currently is? Is it A, 8th week of pregnancy? Is it B, 10th week of pregnancy? Is it C, 12th week of pregnancy? Or D, 18th week of pregnancy? Your 5 seconds begins now. The correct answer is letter D, 18th week of pregnancy. As 8 weeks of pregnancy, the uterus is still within the pelvic area. At 10 weeks, it remains within the pelvis. By 12 weeks, the uterus and placenta have grown, beginning to expand into the abdominal cavity. However, it's not until approximately 18 weeks that the uterus has fully risen out of the pelvis and is expanding into the abdominal area. This knowledge is important for assessing normal progression of pregnancy. Question number 4. Which of the following urinary symptoms does the pregnant woman most frequently experience during the first trimester? Urinary symptom experienced by pregnant women in first trimester. That's the question. Is it A, frequency? Is it B, dysuria? Is it C, incontinence? Or D, burning? Your 5 seconds starts now. Time is up, you guys. The correct answer is A, frequency. Let me explain why. Urinary frequency during the first trimester is caused by pressure and irritation of the bladder by the growing uterus. This is a normal physiological change of pregnancy. Dysuria, incontinence, and burning are symptoms typically associated with UTI, not normal pregnancy changes. Understanding normal pregnancy symptoms helps nurses differentiate between expected changes and potential complications. Board exam type of question number 5. Mrs. Jimenez went to the health center for prenatal checkup. The student nurse took her weight and revealed 142 pounds. She asked the student nurse, how much should the gain weight in her pregnancy? Now, this is the type of question which it's testing your knowledge about the general concept when it comes to pregnancy. If you're going to take a look at it, I want you to underline weight gain in pregnancy, because basically that's all the question is. Regardless of the scenario that was given on the first part of the question, it's just asking you what's the normal weight gain during pregnancy, period. Don't make it complicated. Let me read to you the choices. Is it A, 20 to 30 pounds, B, 25 to 30 pounds, C, 30 to 40, or D, 10 to 15? Your 5 seconds begins now. The correct answer is letter B, 25 to 35 pounds. A weight gain of 11.2 to 15.9 kilograms or 25 to 35 pounds is currently recommended as an average weight gain in pregnancy. This weight gain consists of the following: fetus 7.5, placenta 1.5, amniotic fluid 2, uterus 2.5, breast 1.5 to 3, blood volume 4 pounds. Body fat 7 pounds, and body fluid 7 pounds. Proper weight gain during pregnancy is important for maternal and fetal health. We are halfway through the questions. How's your score so far? Let's proceed with board exam type of question number 6. The nurse is preparing Mrs. Jordan for cesarean delivery. Which of the following key concepts should the nurse consider when implementing nursing care? Now, I want you to understand cesarean delivery. And I also want you to encircle nursing care, implementing nursing care. What's your number one consideration for nurse implementation during cesarean delivery or pre-op of CS? That's the question. Let me read to you the choices. Is it A, explain the surgery, expected outcome, and kind of anesthetics? B, modify preoperative teaching to meet the needs of either a planned or emergency cesarean birth? C, arrange for a staff member of the anesthesia department to explain what to expect post-operatively? Or D, instruct the mother support person to remain in the family lounge until after the delivery? Your 5 seconds starts now. Time is up, you guys. What is the correct answer? Letter B. Modify preoperative teaching to meet the needs of either a planned or emergency cesarean birth. Here's why. A key point to consider when preparing a client for cesarean delivery is to modify the preoperative teaching based on whether it's a planned or emergency procedure. The depth and breadth of instruction will depend on the circumstances and time available. While explaining the surgery, option A is important, it doesn't address the need to adapt teaching based on the situation. Options C and D are not primary nursing responsibilities in this context. Last 4 questions. Here's board exam type of question number 7. Bettine Gonzalez is hospitalized for the treatment of severe preeclampsia. Which of the following represents an unusual finding for this condition? Now, I want you to underline preeclampsia and I want you to encircle unusual finding, because those are the key words for you to arrive with the correct answer to answer this question right. Alright, let me read to you the choices. Is it A, generalized edema, B, proteinuria 4+, C, blood pressure of 160 to 110, D, convulsions? Your 5 seconds starts now. Time is up, you guys. The correct answer is letter D, convulsions. Here's the rationale. A, B, and C, generalized edema, proteinuria 4%, and blood pressure of 160/110 are all findings consistent with severe preeclampsia. Convulsions, however, indicate progression to eclampsia, which is an obstetrical emergency requiring immediate intervention. This distinction is critical for nurses to understand as it affects the urgency and type of care provided. It's kind of like a tricky question, you guys. Now, here's question number 8. Nurse Jelly explains to the client who is 33 weeks pregnant and is experiencing vaginal bleeding that coitus is... Nurse says this is a definition of term. What is coitus? That's the question. Is it A, need not be modified in any way by either partner? B, is permitted if penile penetration is not deep? C, should be restricted because it may stimulate uterine activity? Or D, is safe as long as she is in side-lying position? Interesting. Your 5 seconds starts now. Time is up, nurses. What is the correct answer? Letter C. Very good. Should be restricted because it may stimulate uterine activity. Here's why. Listen to this. When a pregnant woman experiences vaginal bleeding, especially in the 3rd trimester, sexual intercourse should be restricted. Coitus can stimulate uterine contractions, which could worsen bleeding or lead to preterm labor. Option A, B, and D are incorrect as they suggest sexual activity is acceptable, which could endanger both mother and fetus in this situation. Women with a history of spontaneous miscarriage may also be advised to avoid coitus during the time of pregnancy when a previous miscarriage occurred. Last 2 questions, make this one count. Board exam type of question number 9. Mrs. Priscilla Abel, a 32-year-old multipara, is admitted to labor and delivery. Her last 3 pregnancies had short stage 1 of labor. The nurses decide to observe her closely. The physician determines that Mrs. Abuel's cervix is dilated to 6 cm. Mrs. Abuel states that she is extremely uncomfortable. To lessen Mrs. Abuel's discomfort, the nurse can advise her to. Nurse says, based on the current situation or the situation of the question, what will be your advice to the patient, in this case, Mrs. Abuel's? Alright, be mindful of the keywords such as 6 cm dilated, what else, multipara, last 3 pregnancies had short stage 1 of labor. In identifying your nursing health teachings to Mrs. Abels, okay? Now here are the choices. A. Lie face down. B. Not drink fluids. C. Practice holding breaths between contractions. Or D. Assume Sims position. Your 5 seconds starts now. The correct answer is letter D. Assume Sims position. Sims position, or side lying with the upper leg flex, puts the weight of the fetus on the bed rather than on the woman's body and allows for good circulation in the lower extremities. This position can help reduce discomfort during labor. Lying face down, option A, would be uncomfortable and potentially dangerous during labor. Restricting fluids, option B, could lead to dehydration. Holding breath between contractions, option C, is not recommended and could affect oxygen supply to the fetus. Last question, you guys, board exam type of question number 10. Which is true regarding the fontanelles of the newborn? Again, testing your knowledge about pediatric nursing, newborn babies, fontanelles for newborn. Based from this, which is the facts about, or a fact about fontanelles for newborn? Is it A, the anterior is larger in shape when compared to the posterior fontanelle? B, the anterior is triangular shaped and the posterior is diamond shaped? C, the anterior is bulging, the posterior appears sunken? D, the posterior closes at 18 months and the anterior closes at 8 to 12 months. Your 5 seconds begins now. The correct answer is letter A. The anterior is larger in shape when compared to the posterior fontanelle. Here's the rationale. The anterior fontanelle is indeed larger than the posterior fontanelle. Additionally, the anterior fontanelle is a diamond shape and closes at around 18 months, while the posterior fontanelle is triangular in shape and closes earlier at about 8 to 12 weeks. Neither fontanelle should appear bulging, which may indicate increased intracranial pressure, or sunken, which may indicate dehydration. In a healthy newborn, assessment of the fontanelles is an important part of newborn physical examination. That concludes our review of these 10 critical maternal and child nursing questions. I hope you found this practice session helpful in preparing for your nursing board exam. If you enjoyed this content, please check out my related videos for more nursing test prep. Your preparation now will pay off when you sit for your actual exam. Once again, this is NurseBrain, inspiring greatness one lesson at a time. Thank you for watching and good luck with your studies.